طيب، بسم الله الرحمن الرحيم. The first lecture will be about the treatment of the myasthenia gravis. And as you know, myasthenia gravis is an autoimmune disease affecting the neuromuscular junction. يبقى antibody affecting the receptor of the neuromuscular junction, which is the nicotinic receptors of acetylcholine, leading to dysfunction in these receptors. This will lead to fluctuating skeletal muscle weakness. يعني البيشنت at the morning بيكون يعني good at the morning, and then within the day and evening the patient feel the weakness of the muscle. زي ما قلنا worsening of the activity, the patient feel the fatigability within time, and improve with rest. When the patient take a rest, so the symptoms and weakness of the muscle will improve. This is due to antibodies against the acetylcholine receptors. This is the mechanism of myasthenia gravis or pathophysiology. طبعا زي ما عارفين this is the neuromuscular junction, and when there is a signals and action potential هنا in the end of the neuron بيحصل release for the acetylcholine, which is bind to the receptors and give action potential in neuromuscular cell أو يعني in muscle contraction of the muscles. This is the normal. When there is a myasthenia gravis, دقيقة, this is in myasthenia gravis here, there is antibody against this receptor. So the antibody could block the receptors. So acetylcholine cannot bind to the receptors. It affecting a part of the receptors. وبالتالي كل الacetylcholine will bind to just a small part of the receptors, which is lead to exhaustion of acetylcholine. The neurons will secrete more acetylcholine to activate the muscle, وبالتالي بيحصل exhaustion for acetylcholine. Within time, the patient feel the weakness. Because this is the first theory, the antibody, it block the receptors. The second, the antibody is bind to receptors, which is lead to internalization. يبقى الريسبتورز itself invade to inside the cell, and then inside it will be degraded by the cell itself, وبالتالي بيحصل destruction for the antibody due to internalization تدخل جوا هي نفسها. The third is forming of the complement. The antibody with the receptors cause or make complement affecting the receptors, affecting these receptors or this gate of uh, sodium gate, which is restart the action potential, وبالتالي also is affecting the action potential. Whatever the antibody do, the result will be decrease of the number of acetylcholine receptors, which is lead to impair the neuromuscular transmission, and then muscle weakness and fatigue. So this is the mechanism of the myasthenia gravis. طيب, the clinical features after the receptor decrease in number and become non-functioning for some receptors. So the features will be the major symptoms is fatigability and weakness, which is mainly in proximal muscle, in proximal skeletal muscle, and worsening with the day, with the end of the day. The patient زي ما قلنا at the morning بيكون okay, and then within day and evening the patient feel this weakness and fatigability. And it could be improved with rest, لأنه طبعا قلنا بيحصل exhaustion للأسيتايل choline. With the rest, the acetylcholine amount and concentration will increase, and the patient again feel well or better than before. The most common involve muscle, and the first muscle that involved and it is the common first symptoms that patient بيجي بيها is ocular muscle, the eye muscles, and the patient come with ptosis mainly and diplopia. يعني أول حاجة بتظهر على المصل اللي هي ptosis, the eyelid is dropped like that, and this is the first symptoms of the patient. Then it could affecting the popular muscle أو bulbar muscle. The bulbar muscle اللي هي for the chewing and يعني the above muscles of the mouth and the neck, so it can cause dysphagia for the patient, dysarthria, and difficulty in chewing in proximal muscle. Then the patient develop difficulty in climbing stairs أو stairs ما بيقدر يطلع كويس, and difficulty in riding from chair. The patient will sit cannot stand again. يعني دايما ان احنا even in examination of patient لما يجينا بنقول له sit down and stand up, sit down and stand up. After a while the patient بيحصل له exhaustion للacetylcholine so cannot stand again. Because this is the bulbar effect. The last muscle could be affected within time, and it is a serious which is lead to which is called as a myasthenia crisis, the respiratory muscle. Myasthenia crisis mainly is a respiratory failure due to affecting of the respiratory muscle from the myasthenia gravis, and it is a late symptoms. Here also it is clear here the clinical features. The patient starts okay with the battery full. Within time, the muscle develop fatigability. Looks like the battery is low. زي ما قلنا within effort, the patient feeling the exhaustion, and at rest again the battery become better لأنه زي ما قلنا الأسيتايل choline will increase. This is the eye drop which is known as ptosis, and this is the symptoms in chewing and drinking and swallowing and climbing stairs أو اللي هو rising from the chair زي ما قلنا, and lastly it could affecting the respiratory muscle and cause the respiratory um, uh, crisis أو بيسموها myasthenic crisis. طيب how we can manage the patient. عندنا general principle for treatment. طبعا زي ما قلنا the cause of the myasthenia gravis is autoimmune, وبالتالي any autoimmune disease we don't have a definitive treatment لأنه the definitive treatment should affecting the underlying cause, or underlying cause here the immunity. We can't to attack the whole immunity all the time, so we try to decrease the immunity or suppress immunity in patient with aggressive myasthenia gravis. وبالتالي there is no definitive treatment. The treatment is to relieve the symptoms, and then if the patient has more aggressive cases, so we can give the patient something to suppress the immunity itself. يبقى we control the symptoms, not curative treatment. The patient with the respiratory symptoms, we have to reassess the patient, نعمل له hospital admission, and then reassess the patient and evaluate the patient لأنه عندنا حاجة خطيرة زي ما قلنا اسمها myasthenic crisis cause a respiratory failure وممكن to cause death. Prevention, um, يعني to prevent the symptoms or to decrease the symptoms, we have to vaccinate the patient and do a moderate exercise, weight control, and correct the visual impairment, diplopia قلنا اللي بتحصل معاها دي وكده اللي هو الدبل فيجن diplopia. Avoid, lastly, avoid the drugs that can aggravate it or worsening the myasthenia gravis. ودي some drugs should not be used in myasthenia gravis. In myasthenia gravis, already we have antibody which is block or destruct a part of the nicotinic acetylcholine receptor of skeletal muscle junction. وبالتالي we have a small part of the receptors. We have to keep this receptor from other factors that could affect it. لأن otherwise it will decrease the receptor more and more and cause يعني increase of or progression of the disease. So any drug that affecting the neuromuscular junction receptors should be uh, prevented or it is a contraindication. This drug as fluoroquinolones, macrolides, aminoglycosides, and muscle relaxants. All the first three drugs are antibiotics. الفلوروكوالينولز اللي هم زي السيبروفلوكساسين اللي بينتهوا بالفلوكساسين الليفوفلوكساسين وكده. The macrolides is antibiotic like uh, azithromycin like that. And aminoglycosides also is antibiotic بينتهي بميسين gentamicin streptomycin and like that. And the muscle relaxant will be discussed in next lecture inshallah. Muscle relaxant عادة we use it if there is spasticity of muscle لكن more commonly used in anesthesia to relax the muscle in anesthesia. طيب then this is the pharmacological treatment of myasthenia gravis. يعني البيشنت اللي بيجينا ب myasthenia gravis after we do this general principle we give a treatment for the patient. The pharmacological treatment, the first line for almost all cases, we give something to increase the acetylcholine in the body to affecting the receptors يعني ما يحصل له exhaustion to prevent the exhaustion of the acetylcholine and to increase the duration of action of acetylcholine. وده بيدينا symptomatic relief for the symptoms and we use a drug known as a pyridostigmine. And this is the first line for almost all cases of myasthenia gravis. يا شباب في واحد please mute her or himself. في واحد الميكروفون بتاعه is open. Kindly close your microphone. طيب the second in a more aggravated case which is not completely respond for the pyridostigmine we can give something to affecting the antibody itself to prevent the more destruction of the receptors. So we give immunosuppressor or sometimes in some cases we can do a thymectomy. Thymectomy اللي هو removal of the thymus. الثايمس زي ما عارفين إنه enhance the immunity and 50% of patients who have thymoma اللي هو عندهم tumor of the thymus is related to myasthenia gravis. وبالتالي we can remove the thymus or يعني less aggressive treatment we use immunosuppressant drug. نعمل immunosuppressant which is suppress the immunity, suppress the attack of the receptors. The commonly used drug is corticosteroids اللي هو بندي prednisolone. And you could use other drugs that affecting immune زي الأذى ولكن commonly we use the prednisolone which is steroids. Unfortunately, when you start the steroids to suppress the immunity, sometimes it could worsening the myasthenia gravis. We don't know why when we give the immunosuppressant in some patient may aggravate the myasthenia gravis in first or 2 weeks. بعد ذاك the patient return to the normal and improve ولكن in first 2 weeks it could affecting the patient and worsening the symptoms. Why for? We don't know زي ما قلنا لكن we suggest that it affecting the transmission. يعني when we give it, it affecting the neuromuscular junction and affecting the transmission which is lead to suppression of the effect of the pyridostigmine and drugs which is we will give for the patient. طيب يبقى this is the introduction what we need to know about the myasthenia gravis. Then we will discuss the drugs. And the main drugs زي ما قلنا use is known as acetylcholinesterase inhibitor, and we use the pyridostigmine. We will discuss all the acetylcholinesterase inhibitors, and especially طبعا the pyridostigmine, the first line, and we will discuss the drugs that related to acetylcholine inhibitors. طيب, to understand the mechanism of action, we back here and we back to the normal neuromuscular junction transmission. زي ما شايفين, this is normal, this is acetylcholine is secreted here bind to the receptors cause a muscle contraction. لما يكون عندنا myasthenia gravis, a part of these receptors are blocked, وبالتالي all acetylcholine working in a small part of the receptors, which is lead to exhaustion of acetylcholine. كل مرة الacetylcholine يطلع more and more to give the effect لأنه just working in one or two receptors, for example, so it is exhausted. طيب, we have here enzyme that break down the or metabolize the acetylcholine. اسمه acetylcholinesterase enzyme, which is transfer the acetylcholine, break down the acetylcholine to acetate and choline. If we block this enzyme, the cholinesterase enzyme, so acetylcholine will work for a long time without destruction, and this will lead to decrease the exhaustion of the acetylcholine. The body doesn't need to secreting more acetylcholine. And this is the main idea of our drugs that use is to stop this enzyme, so to increase the acetylcholine and it is effect. طيب, unfortunately طبعا زي ما عارفين, when we increase acetylcholine, it affecting the neuromuscular junction, the nicotinic receptors in neuromuscular junction, but also affecting the other body receptors that activated by acetylcholine. So it can affecting the nicotinic receptors in parasympathetic nervous system, and also affecting the muscarinic receptors in parasympathetic nervous system. طبعا الباراسمباثيك nervous system عنده two types of receptors, muscarinic receptors and nicotinic receptors. So when we increase the acetylcholine, it will affecting also, besides the neuromuscular junction, the parasympathetic nervous system, which is increase the symptoms or adverse effect of the drug. عشان كده بعدين هنلقى the adverse effect of the drug is looks like activation of the parasympathetic nervous system. in heart تعمل bradycardia و hypotension. في respiratory system تعمل bronchoconstriction. It looks like the parasympathetic. So this is the acetylcholinesterase inhibitor and it is effect. طبعا هي indirectly parasympathomimetics. وباراثيمباثوميماتكس لما نقول parasympathomimetics معناها parasympathetic nervous system activation or stimulate the drugs that stimulate parasympathetic nervous system. Sometimes بنقول لها cholinomimetics or mimetics لأنها برضو affecting by increase of acetylcholine. طيب, عشان الدراجز يبقى parasympathomimetic or mimetics, drugs could be directly activating the receptors أو indirectly activating the receptor by increase of acetylcholine, وده اللي بتعمله اللي هي الانتي cholinesterase drugs. anti cholinesterase ما في inhibitor I will يعني يا اما نقول acetylcholinesterase inhibitor او نقول anti cholinesterase directly. طبعا الدايركت agonist للباراسمباثيك directly قلنا activated the receptors بنستخدمها in small uses. عادة بنستخدمها in patient who has eye problem. طبعا الباراسمباثيك decrease the eye pressure وبالتالي بنستخدمه في الجلوكوما. بنستخدمه برضه in patient who has a urine retention after surgery. طبعا برضه عارفين the parasympathetic induce the urination, فبنستخدمه mainly in these two uses. The drugs that used here in myasthenia gravis اللي هم الاسيتايل كولينستريز inhibitors، وعندنا برضو two types منهم بعد شوية هنقولهم. بنسميهم indirect agonist، و they inhibit the acetylcholinesterase and prevent its breakdown, which is increase the acetylcholine and prolong its actions in synapse. نستخدمهم mainly in myasthenia gravis، لكن we could use also in other uses اللي هو زي ما قلنا is affecting the parasympathetic nervous system and enhance the parasympathetic, so we can use it in post operative ileus، ودي بتحصل عادة بعد العملية. the ileum doesn't move well، وعارفين الباراسمباثيك increase the GI motility، وبالتالي ممكن نستخدمها فيه. and in urine retention زي ما قلنا especially post operatively، قلنا البيشنت ممكن يحصل له urine retention and the parasympathetic activation can increase the movement of the urinary tract which is lead to urination of the patient. طيب وطبعا mainly the myasthenia gravis which is will discuss here. طيب the most important point to know here that the drugs that use in myasthenia gravis and affecting the neuromuscular junction by increase the acetylcholine, it can affecting the parasympathetic nervous system and activated the parasympathetic nervous system. So the drug adverse effect will be like the enhancing of the parasympathetic nervous system. Here this is the parasympathomimetics or mimetics drugs اللي هي by direct activation of the receptors or by prevent the enzyme regarding the acetylcholine against the enzyme. طيب زي ما قلنا the acetylcholinesterase receptors inhibitors we have two types فيهم. the medically used one known as a reversible anticholinesterase drug, and we have a non-medical drug which is irreversible anticholinesterase drugs اللي هي بسموها organophosphate، لكن we don't use the irreversible type medically because it is serious. It can cause aggressive symptoms of the acetylcholine increase اللي هي parasympathetic effect وكده، which is can lead to which is called as cholinergic crisis، ودي بيستخدموها as nerve gases وكده يعني، أو في الانسكتسايد المبيدات وكده يعني something which is lead to death، لكن we don't use the irreversible type for medical use. طيب the reversible anticholinesterase the first drug that we have to know is hydrophonium, which is a short-acting drug working from 5 to 15 minutes. It's not cross the blood-brain barrier، و it is أي حاجة بتكون التركيب بتاعها بيكون complex quaternary amine cannot cross the barriers، يعني it keep in a special compartment، it doesn't cross from compartment to compartment. وأي حاجة بتكون ال construction بتاعها أو structure بتاعها tertiary or easy structure it can cross، وبالتالي كان cross. This drug is quaternary amine، وبالتالي polar and يعني water soluble more water soluble cannot cross the lipids barriers، وبالتالي peripheral effect only زي ما قلنا short duration of action 5 to 15 minutes. That is why we don't use the drug for treatment. بمعنى we give the drug which is block the acetylcholinesterase receptors and inhibit them and increase the acetylcholine لكن just for 5 to 15 minutes. So if we use a drug for treatment we need to give the patient the treatment uh, every 15 minutes or every half an hour like that. وبالتالي we need a many dose, so we don't use the drug for treatment, we just use the drug for diagnosis. When we have a patient who has a myasthenia gravis, or we suggested the patient has a myasthenia gravis. We exhausted the patient. نقول له أقعد وقوم وأقعد وأقيف وأقعد وأقيف. يعني sit down and stand up, sit down and stand up. And then when the patient exhausted, we give the patient this hydrophonium. The patient return to normal after we give the drug for a minute. So it is a diagnostic for the patient. This test known as tensilon test. Also, it could be appear in the ptosis of the eye. يعني wherever we give the patient this drug, the ptosis of the eye اللي هو eyelid drop الكبير قلناها, it will be returned to normal. So it is known as a tensilon test and used for diagnosis of the myasthenia gravis. The second drug is phyostigmine. The same, it blocks the acetylcholinesterase enzyme لكن for a longer time from 30 to 2 hours. This is the duration of action, and it is a tertiary amine. يعني tertiary يعني 3 amine, which make it more lipid soluble and can cross the central nervous system. It is used mainly as eye drop for glaucoma. قلنا الباراسمباثيك and acetylcholine can decrease the eye pressure. والجلوكوما here increase of eye pressure, so it could be used as eye drop for this patient. Also used to reverse reversal of the central anticholinergic toxicity. لو في patient عنده blocking for the receptors to other cause to drugs, ان احنا استخدمنا له atropine or something which is block the muscarinic or nicotinic receptors, we can use the drug to reverse the patient. طبعا here this drug will increase acetylcholine والpatient return to normal. And then we have neostigmine, كلهم نهايتهم بتكون استجمين كده. Phyostigmine, neostigmine, and pyridostigmine. Neostigmine is quaternary amine, doesn't cross the blood-brain barrier, also has the same duration of action, about say 30 to 2 hours. الuses بتاعته it could be used as a second line إذا ما لقينا البيريدوستاجمين ده in patient with myasthenia gravis. The first line is pyridostigmine. This is as alternative in myasthenia gravis treatment. Also other uses الجبال قلناهم the paralytic alias and urinary retention. Also could be used for reversal of the patient with drugs that use as a neuromuscular blocker. قلنا in anesthesia, we give a muscle relaxant that block the receptors of acetylcholine. بيسموها neuromuscular blocker. We use a non-depolarizing type هنجيه بعدين in next lecture. المهم after the anesthesia and when we need to return the patient uh, to normal. طبعا after anesthesia we have to discharge the patient and the patient start to moving his muscles, the respiratory muscle and skeletal muscle and كده. So we give this drug to reverse the patient لأنه increase the acetylcholine. The pyridostigmine, the main drug and first line for treatment of myasthenia gravis, has a longer duration of action, up to 8 hours. We give the drug 3 or 4 times per day, and it doesn't cross the blood-brain barrier, and it is first line for treatment as a maintenance for long-term use for myasthenia gravis. طيب. Then this is the main drug that use. Then we have drug more selective to acetylcholine of the brain. And we call them as a centrally acting drug, mainly working in central nervous system. And we have a drug known as dompizil. Also we have rivastigmine and glantamine. They are more selective. ودي طبعا is used for treatment عادة برضه symptomatic treatment of Alzheimer disease. In Alzheimer disease دايما بيكون عندنا loss of memory, وال loss of memory is related to decrease of acetylcholine in the brain. So we give this drug which is increase acetylcholine in the brain, and we could use the drug for treatment of Alzheimer. طيب the irreversible anticholinesterase drugs اللي هم بسموهم organophosphates drugs, زي ما قلنا doesn't use medically. We have ecothiopate, isoflurosphate, and malathion, and parathion, and nerve gases. This drug is irreversibly bind to the acetylcholine, which is make the duration is very long duration of action. The progression of the drug is gradual. يعني when we give the drug, it start to block the acetylcholine enzyme اللي هي acetylcholinesterase لكن gradually. This is we call it as aging. يعني within time it block the acetylcholinesterase irreversible. We can return the patient to the normal before this aging. يعني before a complete blocking and aging, chemical stabilization of the uh, blocking, so we can retain the patient. After that, it will be difficult to retain the patient and it can kill the patient. زي ما عارفين انه بيستخدموه النيرف gases in war. في الحروب وكده ممكن يستخدموا النيرف gases ده which is lead to uh, increase of parasympathetic symptoms which could be a fatal زي ما هنشوفها بعد شوية. Not medical use except an ecothiopate that could be used as eye drop for the eye to decrease the eye pressure in glaucoma. وهم highly soluble almost all لكن الايكوثيوبيت is not lipid soluble وبالتالي it doesn't penetrate the eye or spreading to the body فبنستخدمه as eye drop if we need. This is the summary of acetylcholinesterase inhibitors. The most important one used in myasthenia gravis is pyridostigmine and hydrophonium. The pyridostigmine is the treatment and hydrophonium is diagnostic في التونسيل test زي ما قلنا. طيب this is the adverse effect of the drug. زي ما قلنا the most of adverse effect appear in parasympathetic nervous system وبالتالي في الكارديوفاسكولار can cause bradycardia and hypotension. في GI it can cause GI motility, increase GI motility وبالتالي تؤدي إلى diarrhea, emesis اللي هو vomiting, nausea and abdominal pain. In genitourinary will lead to urine urgency يعني تخلي البيشنت need to go to the bathroom many times and incontinence. And in exocrine gland it can increase sweating, salivation and gastric secretion. In ocular it can cause a meiosis اللي هو pinpoint pupil. البيوبل بتبقى very constricted and lacrimation. And in central nervous system restlessness وتريمر وكده. والريسبيراتوري بتعمل برونكوسبازم and bronchoconstriction. و it could be used برضو as a test for a patient اللي عنده أزمة لكن in general it can induce الأزمة. فالبيشنت عنده أزمة عشان نتأكد إنه عنده أزمة we can induce أزمة by a drug اسمه ميثاكولين which is similar to these drugs اللي هو acetylcholinesterase inhibitors. طيب يبقى this is the effect of the drug. All these effects through the muscarinic receptors except this is effect in musculoskeletal اللي هو with a very high dose, the toxic dose, it can cause a continuous activation of the muscle which is lead to depolarization blocking بيسموه paralysis of the muscle. طبعا this can lead to زي ما قلنا respiratory crisis by a respiratory failure due to bronchospasm and hypoventilation. This is which is called as a cholinergic crisis when there is a very toxic or very high dose of anticholinesterase, the reversible type, or when we use the nerve gases or insecticide it can lead to this effect. والeffect here severe effect of the parasympathetic nervous system. يعني the patient develop dumbbell بيسموها dumbbell اللي هي diarrhea, urination, meiosis of the eye, pinpoint pupil, and bronchospasm, and bradycardia, emesis, vomiting, lacrimation, and sweating and salivation. طبعا it could be fatal, especially by bronchospasm and bradycardia and increase excretion or secretion of the body, which is lead to severe hydration and blocking of the airways. دي بنسميها cholinergic crisis، عادة بتحصل من ال irreversible type والinsecticide. If the patient develops these symptoms, and احنا we give something to stop the acetylcholine effect by blocking its receptors، بندي حاجة اسمها atropine. طيب، what is the contraindication and precaution when we don't use the drugs for myasthenia gravis؟ يعني one we don't use the pyridoxine. If the patient is asthmatic or has a bradycardia or AV block، معروفة طبعا لأنه it gives the same adverse effect. And peptic ulcer also the parasympathetic increase the secretion of the GI. And if there is a mechanical obstruction, it will lead to rupture. طبعا it will increase the urination, increase the contraction of the muscle. If there is a mechanical obstruction, it will increase the pressure and we will lead to rupture of the organ. And in coronary artery disease طبعا it is associated with hypotension and bradycardia، وزي ما قلنا it can lead to aggravation of this disease. Lastly, we have a myasthenia crisis. احنا عندنا حاجة اسمها cholinergic crisis، وقلنا دي من الهاي acetyl cholinesterase inhibitors أو من ال irreversible. عكسها بتحصل لنا حاجة اسمها myasthenic crisis، ودي there is acute severe exacerbation of the myasthenia gravis. يعني there is no acetylcholine and a very short or very يعني small part of the receptors is active. يبقى البيشنت عنده myasthenia gravis and it is progressive lead to myasthenic crisis. طبعا قلنا is affecting the muscles. Myasthenia gravis, the most important muscle is the respiratory muscle. It can lead to life-threatening emergency and respiratory failure for the patient. It's occur about 20% of the patient and within time. يعني عادة the patient who are not using the treatment within 3 years from starting the symptoms, it can lead to myasthenic crisis اللي هي mainly بتكون في الريسبيراتوري lead to respiratory failure. والبيشنت بيكون عنده severe muscle weakness, dyspnea and dysphoria، وthen lastly يحصل له respiratory failure. It could be induced أو الدراجز اللي ممكن تعمل لها trigger drugs that worsening myasthenia gravis اللي قلناهم في الأول في general principles and of treatment. And infection also the most common one، عشان كده بنعمل للبيشنت فاكسينيشن زي ما قلنا قبل. the surgery يعني anesthesia pregnancy يعني stress almost all day aggravated the myasthenia gravis عشان يحصل لنا myasthenic crisis. The management should be managed in ICU، نعمل له intubation and mechanical ventilation، stop the medication that trigger the myasthenic crisis، وبندي البيشنت